These variants represent a real challenge.
We have been hearing about variants of the coronavirus for weeks now. Two of them, one first found in the UK, the other in South Africa, have now been confirmed in Canada. And that has officials sounding the alarm.
If these new strains take hold, the consequences will be dire.
The third wave is going to be upon us very soon, and that third wave is much worse than the first and second combined.
On Friday, Ottawa announced new mandatory quarantine rules to discourage non-essential travel, with flights to Mexico and the Caribbean suspended until the end of April, all in hopes of curbing the spread of the variants. But will it work? And have we learned anything new about these variants? We're joined now by infectious disease specialist Dr. Lisa Barrett and once again Dr. Zane Chagla. Dr. Barrett, let's begin with the travel restrictions announced by the federal government. There's concern that they're not enough. And here's what the federal transport minister had to say on Rosemary Barton Live this morning.
We even considered banning all flights, but that would have had a detrimental impact on our the delivery of essential products and services to Canada.
So, Dr. Barrett, how do you feel about what the government has done in terms of travel?
It's a great step. Clearly, we weren't getting there with restricting international travel without some restrictions. And so this gives people a little bit of something to fall back on. However, I do think that one of the key hallmarks of some of these variants, wherever they are, inside or outside our borders, is that they may transmit very quickly and quite possibly before we can keep track of them. And so that means that what I'm saying is that international travel restriction is great, but we also need to be very, very aware that we should be restricting travel within our borders across the country to just essential travel as well. And so I would look forward to people picking up on that fairly quickly and paying attention to the quarantine rules that go along with the travel restrictions.
And of course, you're in Halifax, and the ban on interprovincial travel, or at least the restrictions, have worked well for your province.
They've worked very well, and as much as I love Atlantic Canadians and Nova Scotians, as well as our leadership, which have been very effective, part of our success, outside being on the edge of the continent, is that we are very, very, very aware of lack of travel and quarantine. So, the proof is a little bit in the pudding there.
All right, Dr. Chagla, here's a question we received about variants.
Is it possible that the COVID-19 virus currently in Canada has already mutated and simply taken on the same genetic structure as the variant in the UK or South Africa?
Dr. Chagla?
Yeah, it's a great question. So viruses undergo mutation. That's part of a normal process like every other being on Earth. But, these mutations that are described in the variants, both in South Africa, Brazil, and the UK, are essentially like a fingerprint. They're unique to these strains. There's a set of different mutations that really set it apart from others. And so, yes, viruses could mutate to be similar to the UK, Brazil, and South Africa. But essentially, when we're looking for these strains, we are looking specifically for these fingerprints, not something in Canada that has switched to that.
And, we know that the variant that originally was in the UK is in Ontario. And I guess, Dr. Chagla, it makes us realize that it makes the vulnerable even more vulnerable.
Yeah, absolutely. I mean, if you're going to figure out where this is going to spread, all you have to do is look at where COVID is spreading now and really interpose that. It's long-term care facilities, it's vulnerable populations, it's essential workers. And so, unfortunately, they're going to probably see the variant before the average individual who's sheltering at home will.
All right, let's go to our next question on video.
Given this new strain of coronavirus, I've heard mixed things about double masking. Whereas Dr. Fauci says it's absolutely necessary, other doctors seem to disagree. Can you give me your thoughts?
I'll ask both of you, but Dr. Barrett, you first on double masking and masking outside. What's your view?
This has come up since the variant issue of perhaps more transmission has also come up. And quite frankly, the US, where Dr. Fauci is, and Canada, fortunately, are two very different environments at the moment. Right now, we don't have any suggestion or reason for us to consider wearing double masks when we can do the things we know work. So that's stay apart from each other and wear a good mask well. And so right now, the answer is Wear the mask you have well and maintain distance where it's possible, and that should be entirely sufficient. You know, things always change, but that's the advice for now.
And Dr. Chagla, what about masking outside?
Yeah, I mean, the outdoors has incredible ventilation. And so in the context of environments where you can distance or have very brief contact with individuals, I don't think a mask is necessarily the most optimal. If you want to wear one, then so be it. It's really in those settings where people are in close contact, where distancing is difficult for a prolonged amount of time, that one should consider a mask, like outdoor recreational activities on a skating rink.
All right, thanks to both of you.
Thank you.
All the best.